Hello, how are you doing, guys? With you, Dr. Hamid, an ECVMG certified physician. And we've got a high-yield case for the pharmacology for the USMLE Step 1 exam. And through this case, we're gonna understand more about the drugs causing syncope. This is a 68-year-old woman with hypertension taking lisinopril, amlodipine, clonidine, and she has CKD and she reported repeated fainting episodes without chest pain. And her heart rate is 44 beats per minute and the blood pressure is elevated. And after stopping one of her antihypertensives, her symptoms resolve. And the question asked about which mechanism best explains the action of the likely offending drug. So pause the video and think about the correct answer. And the correct answer is B, which is the reduction of norepinephrine release from the sympathetic nervous system. So this refers to the mechanism of action of clonidine. So it has a peculiar mechanism of action. It is not a first-line antihypertensive medication, unlike ACE inhibitor, calcium channel blockers, and the diuretics. We need to give clonidine if the patient has refractory hypertension after giving the first line medication, and it has a peculiar mechanism. It acts through inhibition of the sympathetic supply. There is a sympathetic supply through the ventrolateral medulla, so it is has alpha 2 agonism. So the alpha 2 is inhibitory, so it is agonism has agonistic action for alpha 2 in the ventrolateral medulla. It is gonna inhibit like the sympathetic supply, and this sympathetic supply is very important. For example, when you stand up, there is like a postural stress over your body, and the body needs to maintain blood pressure, and this is achieved through like increasing the sympathetic output to the heart rate to the heart by increasing the heart rate, and also to your blood vessels by causing vasoconstriction. This signal is first transmitted through the baroreceptor. The baroreceptor is gonna sense the decrease in blood pressure, and the send signals to the ventrolateral medulla, and the ventrolateral medulla send like increased sympathetic output to the heart and the blood vessels. And the mechanism of action of clonidine is inhibition of this. So this is the reduction of norepinephrine release from the sympathetic nerves. And the wrong choices first is the inhibition of acetylcholine release at the presynaptic terminals. This is like how the botulism cause its effect is gonna decrease acetylcholine release from the presynaptic terminal. You know that acetylcholine is the transmitter as the neuromuscular junction and responsible for the muscle contraction. And by inhibition of acetylcholine release at the presynaptic terminal, this is the way you're gonna get flaccid paralysis with botulinum toxicity. So this has a peculiar distribution. It goes from upward to downward. It starts like mitosis or pharyngeal weakness, and it decreases all the way down. It may even cause respiratory failure. This is versus like the tetanus, which doesn't cause like a flaccid paralysis, but at the opposite side, the muscles is gonna stuck in contraction. It inhibits the molecule GABA, which is has a relaxing effect. So the muscles are stuck in contraction. So this is like tetanic paralysis, or the muscles are gonna stuck in contraction. And the answer C, which is the blockage of beta 1 receptor in the SA node. This is a mechanism of action of beta blockers. So this patient here doesn't take beta blocker. It takes lisinopril, which is ACE inhibitor, amlodipine, which is dihydropyridine calcium channel blocker, and the clonidine. So this the beta blocker also can cause like syncope, but the patient is not taking beta blocker. This mechanism of action is the blockage of beta 1 receptor in the SA nodes. The beta blockers, especially non-selective beta blocker, has another mechanism, which is the decrease of the sympathetic supply over your body, sympathetic stimulation over your body. Same mechanism of action as clonidine. And the answer D, which is a blockage of calcium channel in the AV node, which is the mechanism of action of non-dihydropyridine calcium channel blocker. This patient here is taking amlodipine, which is dihydropyridine calcium channel blocker, which has mainly a vasodilatory effect, and at the opposite is gonna cause reflex tachycardia. So it can cause syncope. Lisinopril also can cause syncope, but not evident as clonidine, because clonidine is gonna inhibit all the sympathetic output to both the blood vessels and the heart, versus amlodipine and lisinopril. Lisinopril is an ACE inhibitor. Is gonna like prevent the angiotensin, like the angiotensinogen is like got a vasoconstrictor effect, and the lisinopril is an ACE inhibitor. It's gonna like interrupt this pathway, and it's gonna decrease angiotensinogen, so it has vasodilatory effect, the same as amlodipine, which also has primary mechanism of action is through vasodilation. But both of the drugs will have a reflex tachycardia, which is gonna counter this action. So the net effect is not significant like syncope as clonidine, but it can cause syncope. So this is clonidine. Why is clonidine is right choice here. So the blockage of the potassium channels in the AV node, which is the last choice, also wrong. This is refers to the mechanism of action of class 3 antiarrhythmic drugs. Dophytilate, for example, is a class 3 anti-arrhythmic drug, is gonna like interrupt the repolarization in the phase 3 of the cardiac action potential. So by this way, it's gonna like increase the QT interval. When you increase the QT interval, you are gonna like put this patient in something called torsade points, which is like a fatal arrhythmia, which is a cause of syncope also, but this patient is not taking any class 3 antiarrhythmic drugs. So a lot of drugs can cause syncope. For example, the diuretics and the sodium glucose cotransporter inhibitor, SGT, L2 inhibitor, which are giving has two uses. It's like anti-diabetic drugs, and it has like cardioprotective action. By causing diuresis, these drugs may cause syncope. Another class of drugs that can cause syncope is like the vasodilator drugs. For example, as we said, lisinopril as ACE inhibitors and the amlodipine and so hydralazine, nitrates, all of the drugs that can cause vasodilators theoretically can cause like syncope. And the class of drugs that gonna like inhibit the sympathetic output, which is clonidine and beta blockers, and some drugs that has alpha 1 like antagonism. So the drugs that has alpha 1 antagonisms maybe such as brazosine, for example, which is the primary mechanism of action, or a side effect of these drugs, such as, for example, antipsychotic risperidone. The drug may cause alpha 1 antagonism as a side effect. So a lot of different classes that may predispose to syncope. I hope you guys enjoyed our video today, and see you guys in next videos.